This video is going to be a discussion on Medicare for All, by which I mean the single-payer system as put forward by Bernie Sanders. With the 2020 primaries coming up, it seemed a good idea to talk about this, considering there's some different opinions amongst the candidates. Also, I always found it a little strange how quick people were to dismiss Medicare for All, even though they're well aware of the fact that every other first world country does something similar. They spend less on healthcare and get better results. So I'm going to start off going over some healthcare costs, just for context. I'll then discuss some analyses of Sanders' plan, an analysis of Clinton's plan, political pragmatism, because some people think it's a good idea, it's just not politically feasible. I'll then talk a little bit about naivety, because people used healthcare as an example of how Sanders was naive. And lastly, I'll discuss some attacks on Medicare for All. So in the U.S., we spent $10,000 per person for health care. This includes private, out-of-pocket, Medicare, Medicaid, drugs, etc. $3,000 of that was for administrative costs. So this includes things such as billing. $1,000 was spent on prescription drugs, and less than 10% of our population was uninsured. In Canada, they spent half as much per person total. They spent 4 times less for their administrative costs, and they spent half as much on prescription drugs. And I'll have the sources for all these in the video description. Now, during the 2016 debates, Bernie Sanders was asked about how he can push Medicare for All when it would cause a $15 trillion deficit. And the Committee for a Responsible Federal Budget were the people that were quoted. They actually used a study by Kenneth Thorpe. Later, they added some other studies, Center for Health and Economy and the Urban Institute, but the Thorpe one was the one that was probably used more than any other, whether directly or indirectly, so that's the one I'm going to go over. And then I'll very briefly go over a study done by the Mercatus Group, simply because it's a little more recent. So, you may recall we spent $3,000 per person on administrative costs, or about 30% of our total. Canada spends 4 times less, so they spend under 10%. Or rather, if we got to Canada's numbers, we'd spend under 10%. So potentially a 20% savings. And in fact, Thorpe assumed this number in 2005 when he did a study. However, for this study, he only assumed 4.7%. So 4 times smaller a number. And he cited a Vermont study. However, the Vermont single-payer system was not actually a single payer because it included private insurance, federal and state insurance. So his number here doesn't make sense. He assumes a very large increase in utilization. When Canada and Taiwan switched over to a single payer, their utilization rates didn't go up at all. It might be reasonable to assume a little bit. However, his numbers are physically impossible because they would basically imply millions of more doctor visits, and doctors just wouldn't have the time. This is discussed more in one of the references. He doesn't assume any prescription drug savings, and this is something even Clinton supported. He also assumed that costs would go up, though he doesn't say why. Right now, Medicare and Medicaid pay under average, and he's assuming it'll be above average. And he mentions costs over time, the cost curve, I should say. However, he doesn't seem to actually implement that in his study. So if we do our own quick study, we start at $10,000 per person, and if we assume a modest 10% savings, which is still closer to where we are now than where Canada is, that would be $1,000 savings. If we assume that we cut our drugs costs in half, that would be $500 per person. Now we do have uninsured that we have to add, and they make up not quite 10%, but let's assume 10% of our population. However, even though somebody is uninsured does not mean they don't pay anything for medical. They still go to the doctor, whether emergency or not. They still pay some taxes that will go into some healthcare expenditures by the government, etc. But still, let's assume a worst case scenario where they don't put anything into this. Then we'd have to do the full 10%, so that would be an extra $1,000. And let's assume a more reasonable 5% utilization. So that's an extra $500 per person. So that's an extra doctor visit for most people, which again isn't really possible. You couldn't have 300 million more doctor visits, but still, we're being conservative here. If you add all those up, you get $10,000, so we're breaking even. Now this might not sound like a win, but keep in mind that if you can pay the same amount of money, but have everybody in the country insured, not worry about going bankrupt or anything like that, then this would be a win. So this slide was about whether healthcare costs go up or down, and Thorpe's assumptions were very unrealistic. The next slide, this one, is more about how the government would pay for it. So when Thorpe actually got his numbers, he added up private insurance and out-of-pocket, as well as maybe a couple other things, in order to estimate what the government currently does not pay for. However, due to the government having 22 million employees, they actually do pay a lot on private insurance because they have to cover their employees. In addition to that, they subsidize private insurance for a lot of companies. So they spend about $500 billion per year. Well, more now, but $500 billion per year on either covering private insurance for their own employees or subsidizing it for others. So if you add up private insurance, out-of-pocket, and other third party, as I have in this table here, those basically cover all of your private costs for healthcare. Other third party includes things like workers' comp and some other things. There's also some government costs in there, but we'll ignore those. So everything else, Medicare, Medicaid, other government, which includes DOD and VA, government health activities, investment, that's all government costs. So we only need to add up those first three to get private cost. So if you add those up, you get about $1.8 trillion. However, if you subtract out $500 billion that the government spends on private insurance, that brings you down to $1.3 trillion. So $1.3 trillion is roughly how much the government would have had to cover in 2017 if private costs weren't covered. However, Thorpe had $1.9 trillion, almost 50% more. So he did not include what the government spent. So his numbers were very, very off. So you might wonder why. You know, it's hard to believe that somebody who supposedly knows what he does would be so far off. Well, 8 days before he released his study, there was an email in the Clinton campaign, and we know this because WikiLeaks released these emails, where they were talking about getting somebody who would write a bad article or a bad study on Sanders' Medicare for All. So they worked with Kenneth Thorpe, and the Clinton campaign was also close to Vox. Now, Vox was the first media outlet, Vox.com, that wrote an article on Thorpe's study. They released an article just 1 day after Thorpe released his study. Even more than that, Thorpe's study, if you try to find it online, you'll see that it's been uploaded to Dylan Matthews' ScribD account. He's the one who wrote the Vox article. So unlike, say, the Urban Institute or Mercatus that published their study on their own website, the Thorpe study was just some PDF that Thorpe either directly sent to Vox or sent to Vox via the Clinton campaign. So Thorpe's work was an orchestrated hit against Sanders' Medicare for All. His numbers were extremely bad, yet this study was probably used, again, by more than any other. So very quickly, the Mercatus Group study, so they did something similar. They added up private insurance, out-of-pocket, etc. And then they inflated those numbers, or rather they adjusted those numbers to show how much they think Medicare for All would cost the government. However, if you compare what they calculated, the $32.6 trillion over 10 years, to what is already being calculated for private insurance and out-of-pocket, etc., you'll see that it's actually $2 trillion less. So, of course, this was pointed out by the Bernie Sanders camp and some others, where they mockingly thanked Charles Blauhaus, the author of the report. And I should say the Mercatus Group is a libertarian think tank, so trust me, they definitely weren't trying to help Sanders. But they accidentally showed that he would save over $2 trillion. Of course, he tried to walk it back a bit, and the media were very happy to try to help him walk it back. And you can read more into that on the article I show here if you want to see some of the back and forth that was done. But long story short, the Mercatus group accidentally showed that Medicare for All would indeed save money.